Hey guys, my name is Dr. Chris, one of the awesome doctors at the local doctor in Ivanhoe.
Hi, I'm Dr. Eddie. Good
Hey,
to
Dr.
see you.
Eddie.
Hello, Dr. Chris.
Now Dr. Eddie, today we're talking about top tips. And today's topic, top tips, is about dehydration in little people.
Yeah, so we're just talking about springtime tends to have different viruses that cause some problems sometimes, so not necessarily coughs and colds, but it can be gastroviruses that can cause some problems in infants and children. So with that, we just wanted to give you a tip in terms of at home, in between seeing the doctor or before seeing the doctor, just keeping the little one hydrated. And there's a couple ways of doing that.
Yep.
One is if you're breastfeeding or the infant is bottle feeding, the typical tip is to do some smaller and more frequent feeds.
Yep.
Okay, to offer the bottle more often, offer breast more often so they don't dehydrate. The other thing as well is just to keep an eye on their nappies. So you probably will get a feel for how many wet nappies they have per day. And just to make sure that's not dropping off. Yeah.
What to you is sort of like a danger sign from a reduced wet nappies sort of point of view?
Usually a doctor likes to see they're making at least 50% or more wet nappies. If it's under that, you really should be seeing a doctor, and a doctor will kind of assess the situation and just give you some more pointers in terms of making sure that they're hydrated.
Yeah.
If the child's a little bit older and they're not having a bottle, obviously, you might want to go to the chemist. They have brands like Hydrolite or Pedialyte or Gastrolite, and they're just oral rehydration salts, so they're just a little bit better than just giving, say, plain water at hydrating the little one.
And the reason for that, of course, is that if you're losing a lot of fluid, you're not just losing fluid, you're losing fluid and salts. So if you just replace all the lost fluid and salts with just fluid, if you're losing a lot, it can very occasionally cause an imbalance in salts in the blood. Yes, that's an important sort of point, Dr.
That's a very important point. So I think that's a good top tip, and if you ever come in and see a doctor, they can also talk to you about a medication to help stop the vomiting as well. And
the only thing I would sort of add to that as well is the importance of small amounts of fluids very often, mainly for the point of reducing how much fluid is in the tummy, because that just makes us feel a lot better. So with little people, I often go with the rule of 5 ml of fluid, whether that's breast or Gastrolite or whatever, every 5 minutes or so. Like a really simple thing, 5 ml, 5 minutes. Now, the actual amount, of course, depends on the age, and you need to sort of talk to a doctor, but that's a good sort of rule of thumb for little people.
Definitely.
Well,
excellent.
Thanks for listening to our Dr. Eddie and Dr. Chris's top tip, and we'll see you later on in the clinic.
See you next time. Bye-bye.
Bye, guys.